Welcome back, all of you, to Central Government Nursing Officer Exam Preparation Series. There are many good news for the central government aspirants. Central government employees, including nursing officers, benefits are increasing soon. The 8th pay commission is declared and the salary hikes will be expected soon. Unified pension scheme similar to the old pension scheme will be on from April 1st. Here you will have the chance to get 50% of your basic salary as pension in unified pension scheme. The pension age is planned to extend up to 65 years of age. So now let us focus on study and grab the central government job to achieve this. Almost 100 mock tests are uploaded in this channel, and now I am discussing the answers of all these important multiple choice questions. If you have not completed this mock test, please do the mock test first before watching this video in this channel. To add more videos in YouTube, please like and share these videos. More important multiple choice question discussions are upcoming. Let us start the topics now.
The first question is pulsation felt in vagina through lateral vaginal fornix. An early indication of pregnancy is A. Jacquemer sign, B. Goodell sign, C. Chadwick sign, D. Osiander sign. Here the answer is D. Osiander sign. Here you can see I am categorizing this 6 sign into two groups. So Jack and Chad, Goodell and Hagar, Osiander and Palmer. So these two signs are into these three groups: Jack, Chad, Jacquemus and Chadwick, Goodell and Hagar, Osiander is Palmer. See why I am categorizing like this is to remember it easily without any confusion. Let us explain. Jacquemus sign is the bluish purplish discoloration of vagina. This is Jack. Chadwick is also same. Chadwick sign is the another name of Jacquemus signs. In both the cases, the discoloration is the common thing. Bluish purplish discoloration. You can see the color code also to remember. In second section, Goodell's and Hagar. Here you can see softening in both the cases. Goodell sign softening of cervix, Hagar sign softening in the consistency of uterus. So there is softening as a common element. So Good and Hagar. Osiander and Palmer, you can see you are feeling the sign. Osiander sign pulsation felt in vagina and Palmer sign uterine contraction felt during bimanual examination. So these all are the main 6 signs during the pregnancy, and you have to identify in exam hall the differences. That's why you have to categorize and remember with color codes and different categories. Second question. An adverse reaction characterized by flushing and erythema particularly associated with vancomycin is A. Floppy baby syndrome, B. Gray baby syndrome, C. Blue baby syndrome, and D. Red man syndrome. Here the answer is red man syndrome. You can see one short code red one, brown gypsy. You can see the blue baby syndrome is with nitrate or methoglobinemia. That is, blue baby syndrome is caused by the nitrate. Gray baby syndrome is caused by the chloramphenicol. Red man syndrome is caused by vancomycin. That is the connecting word red one. And brown Sickard syndrome is ipsilateral paralysis. It is connected by the word brown gypsy. So please remember this entire short codes for avoiding confusion in exam hall. So here the answer is vancomycin is causing red man syndrome. Red one. You can see the question and remember the shortcut. Let us go to the next question. A conscious victim of motor vehicle accident arrives at the emergency department. The patient is gasping for air, is extremely anxious and has a deviated trachea. What diagnosis should be the nurse anticipate? A. Pleural effusion. B. Tension pneumothorax. C. Pneumothorax. D. Hemothorax. See, here the answer is tension pneumothorax. We can see some classic features of tension pneumothorax: rapid breathing and heartbeat. So the pulse and respiratory rate will be high. Contralateral tracheal deviation. See, this is the classic sign. Tracheal deviation will be seen in tension pneumothorax. Ipsilateral absent of breath sounds. See here, the absence of breath sounds can be found in both the pneumothorax and tension pneumothorax. But in tension pneumothorax, it will be more prevalent because the tension formed inside the thoracic cavity is higher and it is more dangerous as well. So tension pneumothorax is with tracheal deviation and it is an emergency to treat immediately. Next question. The impaired ability to recognize letters or numbers drawn by an examiner's fingertip on the patient's skin is A. Agraphesthesia, B. Akathisia, C. Aphasia, D. Ataxia. Here the answer is agraphesthesia. Agraphesthesia is the impaired ability to recognize letters or numbers drawn by an examiner's fingertip on patient's skin. So what are the other terms? Akathisia is the inability to remain still. The patient is not able to stay still. Aphasia, this is a language disorder that affects a person's ability to communicate. Here you can see different kinds of aphasia. For example, Broca's aphasia, that is the expressive aphasia. There are another category also, that is motor aphasia. These all things are already discussed in previous exam preparation videos. Please refer that videos. Ataxia is the impaired coordination and balance. So ataxia can be an effect of cerebellum. So let us go to the next question. Karatkov sound is the sound of A. Bubble during peristaltic movement, B. Brachial artery while recording the BP, C. Heart during the closure of semilunar valve, D. Lungs during inspiration. Here the answer is brachial artery while recording BP. Karatkov sound is related to BP recording. You can see the diagrams for better memorization. Sixth question. Pulsus paradoxus refers to an exaggerated fall in a patient's blood pressure by greater than 10 mm Hg during A. Expiration, B. Inspiration, C. Both, D. None of the above. Here the answer will be inspiration. The pulsus paradoxus is the fall in BP during inspiration. Seventh question. The nurse entering the room of a patient who is blind. The nurse should do which of the following first? Option A. Stand directly in front of the patient while talking. B. Talk to the patient in a loud voice. C. Speak before touching the patient. D. Ask the patient two questions that can be answered in yes or no. See, this is an application level question, so you have to think very wisely to answer this, because all of the options will be almost right, but one is most appropriate or one is having the priority. So the answer here is speak before touching the patient, because I have already told you, when you are attending the application level questions, you have to see the priority and guidelines and sometimes negative words. So here the first step is, because he is already blind and you have to speak the patient before he is aware or before he is being touched, because if you touch without a introduction or a speech, the patient will become panic and it will not be professionally good for you. So this is the first thing you have to do. Then talk to the patient in a loud voice is also okay, and all other options can be considered, but still the first option will be speak before touching the patient. In dengue fever, the vector is a Culex mosquito, B. Aedes aegypti, C. flavivirus, D. toga virus. This is also a tricky question, because here you have to first identify what is vector and what is the agent. Then you have to identify which vector or which agent is causing the disease. Here the question is for vector, so we will consider only for the vectors. Here the vectors are, see, the answer is Aedes aegypti. Only two vectors are given in this option, so with the elimination itself you can remove this flavivirus and toga virus, because these are not vectors, these are the disease causing agents. So in Culex and Aedes, which one will be causing dengue fever? For that you have to refer this formula. This formula is Culex Jaf, Aedes Mcqs, malaria anopheles. So this terminology you have to remember in the exam hall. Culex Jaf means Culex mosquito is causing Japanese encephalitis, avian flu and filariasis. Jaf, Culex Jaf. Aedes MYDCZ, that is Mayaro fever, yellow fever, dengue fever, chikungunya, Zika. These all diseases are caused by the Aedes mosquitoes, and malaria is caused by the Anopheles mosquito. So please remember this for avoiding confusion in exam hall. Next question is, while giving post-operative discharge instruction to a patient who had abdominal surgery, all the below regarding wound healing are true except option A, avoid tight belt and clothes with material that may rub the wound. B is bathing to soak abdomen is preferred. C, pain medication may affect ability to drive. D, irregular bowel habit can be expected. Here also an application level question, and you have to be careful with the negative words here. True except, you have to see the except word. So don't jump into the right answer, it should be a wrong answer only, because the answer which is not appropriate in this scenario you have to select. So the answer is bathing to soak abdomen is preferred. See, to soaking the abdomen is not preferred because it can irritate the wound and it can cause infection. So here the strategy is check the negative word in this application level question. So whenever you attend an application level question, first of all you have to see the priorities, you have to see the guidelines, you have to see the negative words as well. Go to the next question. A congenital disorder of nasopharynx is option A, choanal atresia, B, coccygesia, C, achalasia, D, cachexia. Here the answer is choanal atresia. Let us see the topic explanation now. Choanal atresia is the congenital narrowing of the back of nasal cavity that causes difficulty in breathing. What all are the other options? The coccygesia is the sensation or illusion of an unpleasant taste. Coccygesia. That gue word is related to that unpleasant taste or sensation. Then achalasia. Achalasia is a rare disorder making it difficult for the food and liquid to pass into the stomach. This is the disorder of an esophagus to swallow. Then Cachexia is a general state of ill health involving marked weight loss and muscle tone. So these three terms also we explained. These terms will come again in some other questions. You have to be careful to avoid mistake in exam hall. You have to be thorough now to make it right on your exam. Coombs test is to A. Assess hip instability, B. Assess hip dislocation, C. Detect carbohydrate, D. Detect antiglobulin. The answer here is detect antiglobulin. The test, also known as antiglobulin test, is Coombs test. Barlow test and Ortolani test are respectively to assess the hip instability and hip dislocation. Then for detecting carbohydrate, we will do the Benedict test. It will give different color to the carbohydrate level in urine. The interstitial connective tissue that surrounds the liver is A. Kupffer cell, B. Cisterna chyli, C. Glissen's capsule, D. Omentum. Here the answer is Glissen's capsule. The interstitial connective tissue that surrounds the liver is Glissen's capsule. Kupffer cell is the liver macrophages, and Cisterna chyli is a lymphatic structure that found at the caudal end of thoracic duct. Omentum is a large apron-like fold of visceral peritoneum. Next question. A projective psychological test in which subjects' perception of ink blots are recorded and then analyzed using psychological interpretation, complex algorithms, or both is A. Simons-Binet test, B. Sulkovich test, C. Rubin's test, D. Rosar's test. Here the answer is Rosar's test. Rosar's test is a projective psychological test, and Simon-Binet test is for intelligence. Sulkovich test is for urine calcium, and Rubin's test is for checking the tubal patency in infertility clinic. 14th question. A behavioral scale for evaluating post-operative pain in young children is A. Braden scale, B. Apgar scale, C. Cheops scale, D. AVPU scale. Here the answer is Cheops scale. Cheops scale is for assessing the children's post-operative pain. So CH and CH is highlighted to lock this term into your memory. Braden scale is for bed sore. Again here B and B. Braden bed sore. Apgar is for the newborn, everybody knows, and AVPU scale is assessing the level of consciousness. Alert, response to verbal stimuli, response to pain, and unresponsive. It is the AVPU scale for assessing the level of consciousness in a simple way than Glasgow's coma scale. 15th question. Albinism, or the condition in which little or no melanin production, is also called achondroplasia, B. anisocoria, C. achromasia, D. achalasia. The answer is achromasia. Achromasia is albinism. Anisocoria is the unequal pupil size. Achondroplasia is the most common type of short-limbed dwarfism. Achalasia is the cardiospasm. We have already seen in that previous question. It is the condition of esophagus where the patient will have difficulty in swallowing. The gland, which is also known as hypophysis cerebri, is A. Pituitary gland, B. Pineal gland, C. Adrenal gland, and D. Thymus gland. The right answer is pituitary gland. See the position, because of the position, this pituitary gland is known as hypophysis cerebri, which is the position on the underside of the brain. Next question is, an inability to experience pleasure from activities usually found enjoyable is A. Anhedonia, B. Agnosia, C. Abulia, D. Avolition. The right answer is anhedonia. Here, anhedonia is the inability to experience pleasure. Agnosia is the inability to process sensory information. So the person is not able to process it. Abulia is lack of will or drive. Avolition is the lack of ability to engage in goal-directed activities. So anhedonia is the inability to experience pleasure. The tool used to measure the mid-upper arm circumference for children is A. Cheops scale, B. Scotch tape, C. Saccard tape, D. Braden scale. The right answer is Saccard tape. Saccard is for mid-arm circumference. Cheops scales we have already seen, the children's post-operative pain assessment. Scotch tape is for worms, and Braden scale is to assess the bed sore. 19th question. The condition in which both the eyes do not look in the same direction at a time is known as option A. Stye, option B. Strabismus, option C. Tenesmus, and option D. Ptosis. The right answer here is strabismus. Here you can see the diagrams for better identifying. Strabismus, you can see the eyes cannot look at the same direction at a time. Stye is a lump, you can see a lump on the eyelids, and ptosis is the drooping eyelids. The upper eyelid of one or both eyes are drooping. 20th question. A psychological condition when people have a fear of being detached from mobile phone connectivity is option A. Monophobia, option B. Nomophobia, option C. Cleanophobia, option D. Xenophobia. Here the problem for you is, the answer is nomophobia, but you will sometimes confused with monophobia because of the similar spelling. So this kind of question you have to be relaxed and rethink again to choose the right option. Even if you know the right option, sometimes you will be in a hurry and you will tend to choose the wrong option. So here this is a simple question. No mobile phobia is the nomophobia. Monophobia is fear of being alone. Cleanophobia to bed. Xenophobia is fear of strangers. So mono, fear of being alone. Nomo, no mobile phone. Cleano, fear of going to bed. Xeno, fear of strangers or strange things. Hydrocephalus, which of following sign is seen? Option A. Mcqs sign, option B. Murphy sign, option C. Winsep sign, option D. Waiter's tip sign. The right answer here is option A. Mcqs sign. Mcqs sign is the sign to detect hydrocephalus and even brain abscess, because whenever there is water inside a cavity, you will get a resonant sound. So similarly, in hydrocephalus there is water inside. So percussion on the skull at a particular spot will give a resonant sound in the presence of hydrocephalus or brain abscess. Next question. Most common type of a short-limbed dwarfism is, we have already seen previously, A. Acromegalia, B. Ankylosis, C. Hypochondriasis, D. Achondroplasia. Here the right answer is achondroplasia. You can see the features of achondroplasia or short-limbed dwarfism. Here you can see the limbs are very short. So the most common type of short-limbed dwarfism is achondroplasia. Next question. The disease caused by burrowing mites is A. Scrub typhus, B. Schistostomatitis, C. Scabies, D. Scurvy. Here the answer is scabies. You can see different type of mites. Burrowing mites will cause scabies. This is the picture of burrowing mites. Scrub typhus is also caused by a mite, but this is not burrowing mites, different kind of mites. Then schistosomiasis is caused by the freshwater snail, and scurvy is not by any vector, it is vitamin C deficiency. Next question. The disease that also known as kissing disease is option A meningitis, option B mononucleosis, C molluscum contagiosum, D monoidal vaginosis. Here the answer is mononucleosis. See, the kissing disease is infectious mononucleosis caused by the Epstein-Barr virus. Next question. A ratio used to evaluate safety and usefulness of drug for indication is A. Therapeutic index, B. Tolerance ratio, C. Tachyphylaxis, D. Half-life. Here the answer is therapeutic index. So let us see what is the other terms. Therapeutic index is the range of doses at which a medication is effective without unacceptable adverse effects. So this is the safe range. Tachyphylaxis is the rapidly diminishing response to successive dose of a drug. When you are giving more and more drugs continuously, maybe the effect will be diminished. Then tolerance is the person's diminished response to a drug. So when you are giving repeatedly the drug, the body adapts to the presence of the drug and the response will be diminishing. That is the tolerance. Ovulation pain that occurs at mid-cycle is A. referred pain, B. radicular pain, C. Mittelsmere pain, D. Braxton-Hicks pains. Here I think all of you know this one. This answer is Mittelsmere pain. Mittelsmere pain is also known as ovulation pain. The scoring system to assess the gestational maturity of newborn is A. Downey score, B. New-Ballard score, C. SAS score, and D. Apgar score. Here the answer is New-Ballard score. You can see New-Ballard score is the tool for assessing gestational maturity. The other two are for respiratory distress score. Downey score is used for the term neonates and SAS score is used for the preterm neonates. Next question. The black lung disease is caused by A. Iron test, B. cold test, C. asbestos test, D. silica test. Right answer is cold test. Here you can see cold black and asbestos white. This is the short form. So if it is white lung disease, this is asbestos. Here brown lung disease is for the cotton. So the term here is brown cotton business Monday. Monday fever also other name. So Monday fever, brown lung disease, these all are caused by the cotton or bicyanosis. Cotton test. Cold from Andhra. See, anthracosis is the other term for the lung disease caused by the cold. So this is the black cold from Andhra. That is black lung disease. Anthracosis is caused by the cold. Brown lung disease, Monday fever, bicyanosis is caused by the cotton dust. Then asbestosis is white. See, white lung disease is caused by asbestos and siderosis is caused by the iron. A neurological condition in which the patient is unaware of their neurological deficit or psychiatric condition is option A amnesia, option B agnosia, option C anosognosia, option D apraxia. The right answer is anosognosia. Anosognosia is the lack of insight. The patient will not be aware of his own diseases. Here you can see the other terms. Amnesia is just memory loss. Everybody knows this. Agnosia is the loss of ability to identify objects or people. Apraxia is the difficulty with the skilled movement even when a person has the ability and desire to do them. So apraxia is the inability to do the skilled movement. Anosognosia is the lack of insight about ourselves or our diseases. Agnosia is the lack of ability to identify objects or people. Next question is, red raised lesions in hand and feet seen in endocarditis is A. Ashoff bodies, B. Osler nodes, C. Koplik spots, and D. Negri bodies. The answer here is Osler nodes. See, Osler nodes are the nodes which will see in endocarditis in finger and toes, commonly seen in finger and toes. You can see the picture. Ashoff bodies is seen in rheumatic fever. Koplik spots is seen in measles, and Negri bodies can be seen in rabies.
Thank you for watching. Please like and share for more exam preparation videos. Thank you so much.